Greetings, I'm Ed Baker and welcome to this leadership tutorial on the topic of artificial intelligence and public health practice. This is the first of two tutorials on this subject. Today's tutorial will be based on a column that my colleague Dr. Dave Ross and I wrote a while back. The actual reference for that will appear on a slide at the end of today's tutorial. So let's get started. First of all, as you well know, public health practice is changing rapidly in our country and around the world, and public health agencies must adapt to this change. As part of this adaptive process, public health leaders must explore the transformative impact of artificial intelligence. Well, what is this all about? Here are a few guiding principles that could lead the way as you do so. First, improving communication is one key guiding principle. Secondly, optimizing organizational performance. And third, generating novel insights. So let's say more about each of those three things. First of all, in terms of improving communication to better serve the public, as I think many of you know, one can adapt now communications to a much wider range of languages, since, of course, in this country, many people speak many different languages. Further, the issue of customizing content of messages to communication preferences of the audiences is really key. As we all know, the rise of social media and many other forms of communication have changed the way in which younger generations particularly access information. Therefore, artificial intelligence may help in customizing these messages to different ways of communicating. In addition, it's important to utilize artificial intelligence to overcome misinformation on core public health practices. As we all recognize, there's been a lot of misinformation around the area of immunization, and we can use artificial intelligence to counter that misinformation. Further, it is important, I believe, to improve communication to elected officials, and artificial intelligence can also be used to improve advocacy, particularly by sharing the stories of impact. How does public health impact the lives and health of individuals throughout communities across the country? Elected officials really benefit from hearing those stories as a way of shaping policy. Well, there's some concrete next steps that you must consider, we believe. The first of these is really just initiate a conversation with an AI interface, such as ChatGPT or Claude or one of the other tools, to receive factually grounded information or simply for personal use. Further, you can use image generators, such as those mentioned on the slide, ImageFX or DALL-E, to really create impactful images. This was done during the COVID epidemic, the COVID pandemic, to better communicate information through visuals in contrast to the written word. Well, optimizing organizational performance is another guiding principle. So let's talk about that a little bit. There are ways to improve organizational efficiency and ways to improve effectiveness. Well, what might those look like? Well, let's talk about organizational efficiency first. One can have better meetings with AI support. One can actually utilize AI to take notes in a meeting, to draft meeting minutes, so that persons who are responsible for the meeting can review them and distribute them much more efficiently. You can use artificial intelligence to auto-draft email responses and to further improve efficiency and save time in organizations. There are other ways to improve organizational efficiency, particularly since public health agencies are involved in many routine tasks. One can improve task performance by, say, for example, improving the way in which records are kept and reports written in the case of restaurant inspections, which local health departments across the country do on a daily basis. Environmental monitoring and reporting similarly can be facilitated by the use of artificial intelligence. And finally, data entry and data management can be improved by utilizing artificial intelligence along the way. Well, organizational effectiveness is a little different. Here we can use artificial intelligence to improve policy development. For example, when a proposed policy change is shaped, one often receives public comment. Many organizations reach out to receive public comment. These can be pulled together using artificial intelligence, which can be a very time-consuming process if done manually. Local Board of Health deliberations are an example of this, where community input can be pulled together using artificial intelligence to facilitate the process of determining what best policies should be enacted. Further, improving organizational effectiveness can fall into the areas of grant writing and report creation, which I've already alluded to. You can summarize large amounts of background information for a grant proposal. You can also utilize artificial intelligence to transform notes into coherent paragraphs for further use. Organizational effectiveness, finally, can be utilized to review internal processes and issues, to facilitate brainstorming sessions, and really simply to identify what is working. It's a way of evaluating what is working within a public health agency, and artificial intelligence might help. So in summary, improving organizational effectiveness falls along these general lines of better problem solving and understanding what is working. So let's finally talk about generating novel insights, the third guiding principle I mentioned a moment ago. One can utilize artificial intelligence to discover emerging health trends using advanced analytics. This was not done in the past, but during the COVID pandemic, this was utilized, and there are ways to improve not only the development of understanding these emerging trends, but also sharing these trends and any novel insights with a broader audience. So artificial intelligence can help in this area of generating novel insights. So what are some obstacles? Many of you are aware that there are certain obstacles to the adoption of artificial intelligence. Enhancing public trust is one area, equity and ethics another, and finally the whole issue of strengthening workforce capabilities is really central. So how does one go about dealing with these obstacles? First of all, in terms of enhancing public trust, it is very important that you be very transparent in the use of artificial intelligence. The key question here is, how is AI being used and who has access to that information and that data? Further, it's important to ensure that a human is in the loop. These artificial intelligence outputs can have errors, and it's essential that a human be in the loop in any process in which artificial intelligence might be involved. And finally, ensure that quality data is used to create meaningful information. So how might that be done? It's really important in thinking about the equity and ethics issues that all models must be trained on good data. Data sets should cover marginalized populations, and often this is not the case. Therefore, it's extremely important when you're looking at information that's being summarized by AI to look further into the background about the quality of the data that's being used. Well, finally, the third and most significant, in some ways, obstacle here for adoption is the capabilities of the workforce. These can be enhanced by training and education, by technical assistance, and most importantly, by leadership and management, encouragement and support. It's very important for the top leaders in your organization to really encourage and support exploration of the use of artificial intelligence in public health practice. So in summary, AI has potential to transform public health practice. The potential benefits are, as I have said, improve communication both to the public and within your organizations, optimize organizational performance, and finally, generation of novel insights. These are clear areas where this can happen, but my fundamental conclusion is the time to learn about and use AI in public health agencies is now. Give it a try and don't be afraid of it. You'll learn more, and ultimately your work to serve the public will be enhanced. So if you wish to learn more about this, here's some references. I mentioned at the outset the first article by Dave Ross and myself that appears in the Journal of Public Health Management and Practice. You can access this in the online JPHMP Direct site under the Leadership Library that appears there on the opening page. The article by Burrell and colleagues was excellent. This appeared in Health Affairs back a while ago. And finally, there's some excellent stuff coming out of the Kansas Health Institute, which is listed there on this slide. They've done some fantastic work on developing AI policies for public health organizations. So, in summary, this leadership tutorial is designed to highlight a few issues. We'll be doing one more on this general topic. You'll be seeing that later on. But we encourage you to actually take action. Try using AI in your public health agency and explore its use in helping you better serve the public. Thank you very much for your attention to this leadership tutorial.